Hello, Deborah Hunley here, and I'd like to speak with you about syphilis. I chose syphilis as my presentation because there's been a resurgence of syphilis and gonorrhea in the U.S. So I needed to know a little bit about syphilis, a little bit more. So let's go and learn about syphilis. When researching syphilis, I wonder if there was any evidence that the people who lived in biblical times were actually afflicted with this disease. This bacteria has been around for thousands and thousands of years. So why wouldn't it be there? So I looked into evidence that there may have been an explanation of some of the afflictions in the Bible. They may have been sexually transmitted diseases such as syphilis. So scholars have argued about some key scriptures that may show evidence for syphilis. For example, Job's affliction. It says in the Bible that Job was covered from head to toe in boils, and he had pus and infection, and that he had bone pain. And we know that one of the symptoms of syphilis is bone pain or aching, and his affliction was actually hypothesized to be both gonorrhea and syphilis. And David says in 2 Samuel 3:29, he wishes that discharge and eruptions exist in the house of Joab forever. So was it that the scholars in the 1800s were actually thinking of this as evidence, or was this just a justification to convey an idea of sexual impurity in European society? There are three common origins of syphilis. It's a very well studied topic, and everyone has their opinion, and there is actually been found that there's more scientific evidence for the pre-Columbian hypothesis. So first of all, the pre-Columbian hypothesis is that syphilis and other treponemia were present in the old world before the new world, but was misdiagnosed. And the Columbian hypothesis is that when Columbus went to the New World, he brought this pathogen back. And the Unitarian hypothesis is that it's a single species of bacteria that has been modified by its location on the earth, the geography, the climate, the culture, that it all has a part to do with syphilis. Syphilis has always been seen as an impurity, and it was a disgraceful situation to be afflicted with syphilis because it was a sexually transmitted disease or believed to be sexually transmitted, and it was a punishment for immorality and a result of sin. And this is why I believe that there was no rush to try to cure these afflicted people, that they just had to suffer through their sin, and their hands were in the Creator. And as syphilis began to spread throughout European countries, it became an insult that countries blamed other neighboring countries for the affliction. In Germany and the UK, they named it the French disease, and the French named it the Neapolitan disease, and the Danish, the Portuguese, and the people in North Africa said it was a Spanish disease, and the Turks called it a Christian disease. And so all of the stigma that comes with the disease also affected the search for treatment and cures. Treatment for syphilis in antiquity was mercury skin treatment or heavy metals like arsenic, scraping pustules, infecting the sufferer with malaria, and using holy wood and mercury. And these treatments were quite poisonous and very painful. In about 30% of the cases, the syphilis was thought to be cured, but it might have been that the syphilis just became latent. We don't have any information that we can pull from the sources that we can assuredly say that the syphilis was cured. In Tuskegee, Alabama, there's a small community that had African Americans, very poor in the neighborhood, mostly farmers, sharecroppers. They were afflicted by syphilis. Some people in the area. The United States government decided to do an experiment to see what would happen if you just let the disease continue to spread within a community. And they chose poor Black Americans to do this to. And they told them that they had bad blood and they would be treated for bad blood. They would have free hospitalizations and free care and a free burial insurance policy. This was only supposed to be a 6 month study, and it started in 1932. It actually ended up being a 40-year study and was only stopped because it was exposed by a whistleblower in 1972. Syphilis is a sexually transmitted disease found only in humans, but syphilis is caused by a corkscrew bacteria, Treponema palladium. It is a gram-negative bacteria that has several subspecies. Treponema palladium is the venereal syphilis that is transmitted by sexual contact. Yet there are two other bacteria, Treponema palladium endemicium and Treponema palladium pertinue. Pertinue is the endemic syphilis, which is non-venereal. It is known as yaws, a Behel, a Penta. These are found in tropical um, places, and we'll speak about that later. Syphilis can be transmitted both sexually and vertically, which means that you can pass this syphilis on to a child. It is mostly transmitted by sexual contact. It invades the skin through mucous membranes and travels through your lymph nodes to go throughout your body. It usually takes about 30 hours for it to go throughout your body, and you are very contagious without the appearance of any symptoms. So, as soon as you get the bacteria, as soon as you're infected with the pathogen, you're contagious. So, if you look over here, this is in this area. If you will look over here in this area, these pictures, these is venereally transmitted disease of syphilis. It is highly contagious during the primary infection, and you find sores or cankers that are generally painless that appear within the body. And if you'll notice, there was even some on the foot over here. And this child has congenital syphilis, um, and that child is contagious. With men, they develop sores on their penis, but they could appear anywhere on the body. And women's sores will develop in the genital area, inside the vagina, or on the cervix. These sores with the initial infection can last 3 to 6 weeks. If syphilis progresses to the secondary stage, it is characterized by a rash instead of the sores. It appears about 2 to 8 weeks after the sores. It's small, moist sores on mucous membranes, usually lips, nose, mouth, tongue. You'll see here that there's a picture of a tongue. And it also causes fever, weakness, weight loss, hair loss, swollen lymph nodes. And this secondary syphilis is alopecia, the hair falls out. It also can affect your nervous system, and it'll affect it by your neck stiffness and headaches, irritability, paralysis, unequal reflexes, and irregular pupils. The next stage is the latent stage, and then there is the tertiary stage or late stage. Okay, the latent stage occurs when the patient is untreated, and eventually all the symptoms go away. They won't have any symptoms. It can happen, be in 1 year to 5 year or 20 years. It's contagious in the early part of the latent stage, not the latter part. The tertiary stages, which is the most destructive stage, it may begin as 1 year after infection, but it's large sores inside the body or on the skin, and it can cause damage to the cardiovascular system, the heart and blood vessels, and also neurosyphilis, which affects the nervous system, can affect the brain. It can disrupt all of the processes to keep your body working the way it's supposed to work. So I found this case that was quite interesting. In 2015, there was a 62-year-old man who presented at the hospital in the emergency room with aphasia, and he had this aphasia for about 12 days. He had some problems speaking, and they gave him a brain MRI after ruling out quite a few other things, and they saw this mass. And I'm going to circle that mass for you. That they see this mass, or this area right here is what they found, and that area is not supposed to be there. So they diagnosed him with with cancer, brain cancer, and he did not actually have brain cancer. They looked at the film, and they saw that there was a lot of fluid around it. And after seeing there was a fluid around him, they gave him a test for syphilis, and he had neurosyphilis. So he was treated with penicillin for 14 days, and he showed improvement, progress of his cognitive function after 3 months, but it was not back to normal. So there was some permanent damage. So this is a map of where you will find endemic syphilis, which means it's non-venereal. It's a tropical disease, so you will find them in areas. Over here, you'll find them in the tropical areas. That's why you see that South America and Africa and Australia and some other warm places are more susceptible to this disease. It is a chronic disease that it affects you in childhood. It affects the skin, bone, and cartilage. And in 2012, the World Health Organization renewed its efforts to eradicate endemic syphilis. So if you look at these, this is some of the manifestations of endemic syphilis. Remember that this is non-venereal. Now, congenital syphilis happens when a mother with syphilis passes the infection on to their child. Um, in the United States, if a person receives prenatal care, they're less likely to pass syphilis on. But it can be passed. It can be passed on and can go undetected uh, for into the pregnancy, but it can cause stillborn birth, jaundice, low birth weight, blindness, and deafness, and meningitis. And usually, when going to a physician for prenatal care, they will run some standard tests. Now, syphilis can only be diagnosed serologically. The diagnosis of syphilis is obtained by using blood serological test. There has to be at least one treponemial antigen test and one non-treponemial antigen test, and these are available in several commercial versions to diagnose syphilis. We also use a differential diagnosis. We also rule out gonorrhea or other sexually transmitted infections before we diagnose with syphilis. The treatment, standard treatment is benzathine penicillin, which is in a single dose, and procaine penicillin, which is 10 to 14 days. There are alternatives to the penicillin treatment. There's doxycycline, tetracycline, erythromycin, and azithromycin, which is, if you know, it's a Z-Pack. The azithromycin is the Z-Pack. When a person is diagnosed with syphilis, it is also recommended that they have an HIV test. The late stage or unknown duration of a syphilis infection, once you diagnose it, you would use 3 weeks of antibiotics instead of the 1 week or the one dose that you would use for a primary stage diagnosis. There also the alternatives are the same. It's just using a longer time. And some of the syphilis bacteria has shown a resistance to azithromycin, which is the Z-Pak. But it has been used and has been used effectively with endemic syphilis. Latent and tertiary syphilis present challenges for treatment. The damage that the syphilis has caused to the body may be permanent. And in some younger adults, we see ischemic strokes, but usually you'll see a rapidly progressing dementia or a problem with visions and hearing with people who are in these late stages of syphilis. Syphilis is an epidemiological problem throughout the world, and it's now time that we can work together to eradicate this preventable bacterial infection by providing information and education and medical care to the afflicted. It's now time to put this ancient disease under control.